Would you like to talk about the connection about foods we eat, the diversity of the microbiome, the huge role it plays in childhood health, and just how diet and the other factors influence and create that microbiome?
So diet, we know by now, plays a huge role in the microbiome and how it affects the composition of the microbiome. So if a mom is thinking about getting pregnant, what she eats definitely is going to influence her growing baby, right? In the dietary guidelines for Americans, they call out fiber, right? So fiber, time and time again, has always been identified as one of those nutrients of public health concern because we just don't get enough. It's very hard. But in terms of how it affects the microbiome, it is so important because the bacteria in your gut, they naturally reside there. When fiber is introduced into the diet and consumed, it serves as a substrate for, those bacteria that are in the large intestine. They use that as food, especially if the fiber is prebiotic and soluble. It can use that as fuel, ferments it, and it produces these other beneficial bacteria in the gut, which is great because that's strengthening the gut, right? And then we have these short-chain fatty acids, these beneficial metabolites that are produced as a result of fiber fermentation. I think about obesity, metabolic syndrome, all of these diseases, that exist in society. I'm not saying they can be cured by fiber, but we can certainly reduce our risk.